Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
While performing a mental status exam, the psychiatric mental health nurse practitioner asks the patient to count backwards, beginning with 100 and subtracting 7. You know the routine. 100, 93, 86, 79, 72, 65, 58. So I guess I can do it. I passed that. But that is a classic assessment on the mental status exam. So you ask the patient to count backwards, beginning with 100 and subtracting 7. This is an effort to assess which element of the mental status exam: concentration, orientation, visuospatial function, or recall. So again, a very basic assessment question, really evaluating that you understand the difference between the elements of the mental status exam. Remember, the mental status examination, we really are evaluating various aspects of cognitive function with respect to the 6 cognitive domains. And those 6 cognitive domains, they are clearly defined in the review program and clearly defined in virtually every study of cognitive phenomenon. So many of the mental status exams, they're really short, brief, often 30 points. The mini mental status exam, formerly known as the Folstein mini mental status exam, is a famous one, but there's other ones now, other derivatives like the Montreal cognitive assessment. All these 30 pointers, they're really things that can be administered in a matter of minutes, but they really do very succinctly evaluate distinct aspects of those 6 cognitive domains. So when you perform a mental status exam, and more importantly, when you interpret the results of the mental status exam, you are expected to actually understand the significance of the patient's performance and what particular cognitive function or which domain you are evaluating. So when you ask the patient to count backwards, beginning with 100 and subtracting 7, what are you evaluating? Are you evaluating concentration, orientation, visuospatial function, or recall? Very straightforward assessment question, just ensuring that you do understand the distinct elements of the mental status exam. And the answer is concentration. A is the correct answer. Counting backwards or spelling world backwards, another commonly used tool, these are mechanisms to assess attention and concentration. Conversely, orientation is assessed by asking about name, date, time, location. This is the classic AAO times 3 or AAO times 0, times 1, times 2, or times 2. But that's where you assess orientation. Does the patient know his or her name, today's date, the time of day, location, etc.? You're evaluating if the patient is oriented to self or environment. Visuospatial function is another of the cognitive domains, and that's what we assess by having the patient draw those intersecting pentagrams. You have 2 five-sided structures, and on the mental status exam, they are already printed on the paper, and then we ask the patient to copy exactly what they see on their own piece of paper. And what we want to see is that each structure they draw has 5 sides and that they overlap the way it does in the example. That's an assessment of visuospatial function. And very commonly you will see that patients that have deficits in those cognitive domains, either they don't have the appropriate number of sides, they can't replicate the structure, or the structures don't intersect. They are 2 separate things. So it's really very telling, and it's a domain that we wouldn't even be able to evaluate without having them. They have to see the image in front of them, be able to process that image, and then reproduce it with motor function, reproduce it with their own hand. There's several steps of cognitive function that go on there, and sometimes that's the only domain where there is a deficit. And then finally, recall is assessed by stating 3 items and then having the patient immediately repeat what you, the examiner, just said. So you might say, okay, patient, I'm going to say 3 things, and I want you to repeat them for me. Apple, car, ball. And then the patient immediately comes back with apple, car, ball. And then you tell them to remember that, try to hold on to it. You're going to ask them to say it again. And then 3 to 5 minutes down the line, you ask them to recall those items. So that's an assessment of recall. All different elements of the various neurocognitive domains. And you are expected to know what you are assessing when you administer the mental status exam and evaluate their responses to all of these different types of questions.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.